quality of work life among public school nurses in schools division of Iloilo. School nurses play a crucial role in the provision of comprehensive health services to the school population. Studies have documented the positive impact of school nursing. As school nurses perform their roles often independently in the field and given their large caseloads, high levels of motivation are needed to serve this role. Understanding their work conditions and sources of contentment at work are necessary to attract and foster commitment in the field of school nursing. Among the many nursing specialties, research among school nurses is not given much attention. This study aimed to determine the quality of work life of public school nurses in the schools division of Iloilo and whether significant differences exist when grouped according to certain socio-demographic and work-related characteristics. This study utilized a descriptive cross-sectional research design participated by 57 public school nurses. Self-reported data were gathered utilizing the adapted version of Walton Quality of Work-Life Scale with a reported Cronbach's alpha of 0.6. Pertinent permissions to conduct the survey were secured from the division heads. All statistical analysis was aided by SPSS version 23. Descriptive statistics were used to describe the data, while Mann-Whitney U test and Kruskal-Wallis test were used to test for differences after normality of distribution was assessed. This study found that majority of school nurses were young adults, females, married, and with bachelor's degree. Moreover, majority worked as a public school nurse for less than 1 year. All public school nurses were employed as Nurse 2 permanent employees with a salary grade of 15. This study also found that overall, public school nurses had a high quality of work life. This study demonstrated that public school nurses have the highest quality of work life in terms of space that work occupies in their life, indicating work-family life balance. However, among the 8 subscales, opportunities at work and social integration at work have the lowest mean scores. Previous researches on the quality of work life of school nurses in USA and Poland have similar results with this study. Comparing the findings of this study with the quality of work life of hospital nurses in other countries or elsewhere, the result of this study suggests that school nurses have better quality of work life than hospital nurses. Staff nurses in Egypt and South Ethiopia had a low-level quality of work life. Results of studies in India, in Iran, and Bangladesh revealed moderate-level quality of work life. Findings of other researchers in the Philippines also disclosed that staff nurses in Samar, Philippines were slightly unsatisfied with their job. The result of the study provides insights that the school work setting is different from the hospital work environment. Public school nurses deal with promotive and preventive aspects of health with less direct supervision from physicians. Moreover, public school nurses have regular working hours compared to the shifting work schedule of hospital nurses. The results of this study also revealed no significant differences in the quality of work life of public school nurses when classified according to their sex, marital status, educational attainment, and length of work experience. However, quality of work life was significantly higher for middle to older adults compared to young adults. The older the nurses, the more they appreciate working in a public school setting. It was earlier asserted by past researchers that mature nurses have better job satisfaction, productivity, and commitment to the organization. This study concludes that public school nurses have high quality work life and age is a significant factor related to their quality of work life. Nevertheless, Opportunities at work and social integration are perceived to be of the least quality aspects of public school nurses' work life. This study provides evidence that can enlighten school leadership and policymakers to devise ways of improving the quality of work life of school nurses. Public school nurses must be provided with added opportunities for continuous professional development and be given more chances for better social integration to further improve the quality of work life of the nurses tasked to ensure healthy school population.